It's a Get Foxy show. Today's guest, Dr. Melissa Loseke. Loseke. Doggone it. I got it right the second time. Loseke.
You're
Loseke.
Loseke. Melissa's perfectly fine though too.
Oh, goodness. Well, Melissa, thank you so much for taking the time to join us today.
Thanks for
You
having
are an osteopathic doctor.
I am.
And you have multiple specialties, but we had you on because you are an expert in regenerative medicine, functional medicine, and bio-identical hormone replacement therapy. Have I got that correct?
You are correct.
Okay.
I don't know about expert, but it's definitely where my passions lie. A little modest for that expert category there, but that's okay.
Well, I believe that an expert is someone who is usually, 2 or 3 steps above where I'm at. That's kind of my definition. So
Perfect.
by
that definition, we're good.
Well, I'm always curious about how people kind of get where they're at in life. So let's start off by finding out, how did you become a doctor and what made you decide to specialize in what you specialize in?
So I am honestly one of those people I've known since 3. I wanted to be a doctor. It was just my pathway. My mom's a nurse, my grandmother's a nurse. So I don't know if it came from just the exposure there, but my whole life has kind of been geared towards that pathway. When I got into medical school, I probably had a longer list of what I didn't want to do than what I did want to do. When I graduated, I actually went into anesthesia and realized pretty quickly, I actually like people awake and talking and having conversations with them. So I transitioned into family medicine, and I'm here in Omaha, Nebraska. Once I got out of residency, actually went into a family practice, primary care practice. And I lasted all of about 18 months before I realized that it was the hospital system and the insurance companies that were dictating to me how to practice medicine. And it wasn't why I went through the hard work and where my values from a medical standpoint aligned with. So I left and got into, at the time I didn't really consider it regenerative medicine, but now that I've had the experience, it definitely fits in that functional regenerative medicine pathway. Sports medicine, doing ultrasound and X-ray guided injections, platelet-rich plasma, biologics, stem cells, and then really transitioned for the last 8 years into the hormone replacement. And with that, really in my private practice, everything is centered around wellness, not illness. How do I optimize you as a patient? What are your goals? Where do you want to go? And how do we help get you there by utilizing the innovation that exists in medicine?
Wellness, not illness.
Wellness, not illness.
Now that I can get on board with as a traditional Chinese medicine practitioner.
Not just here's a pill, yep.
Yeah, it boils down to a lot more, lifestyle, diet, your daily habits, and then you get into more of the functional medicine side of things, which really, I am a big fan of functional medicine. Now, for those folks who don't know what functional medicine is, can you tell me a little bit more about that?
So, for me, it's really it's optimizing health and wellness. One of the lines that my patients will hear me say, and actually the optimization really came from a patient. He was like, well, yeah, this was a gentleman. We were talking about testosterone levels. And he was like, my primary care doc told me my levels are normal at 250. And I'm like, well, yeah, they are normal. And he goes, but not all normal is optimal. And I'm like, you're exactly right. And so with that just came this whole advent of medicine, and how do we really truly optimize that health aspect and keep people healthier beyond using the traditional senses of medicine. So for example, in my perimenopause and my menopausal females, my primary care background and education tells me I'm supposed to start with Premarin, which is conjugated horse urine and a synthetic estrogen. If that doesn't work, I'm supposed to check her thyroid. And then if that doesn't work, I'm supposed to put her on an antidepressant and pat her on the shoulder and tell us, well, it's just how all of us go through life. To me, that's such a gap in the way medicine should be. We need to be listening to our patients. And again, myself as well. When I hit retirement age, I don't want to be bound to a chair. I want to be active and enjoying life to its fullest. So for me, it's really supporting those goals with each patient. But one of the lines that I really like to kind of, that gets all my patients thinking and questioning is, do our hormone levels drop because we age, or do we age because our hormone levels drop? It's really one of those that kind of makes you stop and go, And it's that whole thought process that is really the basis of functional medicine. And I don't mean to say that hormones are the whole piece or the only piece, but I think they're definitely a bigger part than we give them credit for in how we feel.
You bet. Well, and there are such important parts of our health and the way that we develop as human beings.
Yep.
Hormones are extremely important. And so
Yep.
having those appropriate levels is a big thing.
Absolutely.
So
it's crucial. I mean, what a lot of people don't realize is there's this stigma and negativity around hormone replacement, and you're gonna get cancer, or you're gonna have a heart attack and a stroke. What most people don't understand is that hormone replacement decreases what we call all-cause mortality, meaning your chance of dying from anything. It also decreases your risk of developing any and all types of cancers. And I'll challenge people, name me another medication that touts that. I mean, most of what you hear on the TV is package inserts that say, well, this might cause nausea, vomiting, diarrhea, or death, so talk to your doctor before you start it. So.
And that's a great take on that. Because yes, I hear, well, and I've heard for years that idea that, okay, well, yeah, you don't necessarily want to be on hormone replacement therapy because, well, it increases your chances of breast cancer or uterine cancers. Now, I'm guessing that with bio-identical hormone replacement therapy, this reduces the chances of those cancers showing up.
Yes. So the one area where I will always talk and explain to females is breast cancer. So if you are a postmenopausal woman, meaning you haven't had a period for a year, you typically are not going to have any estrogen, because estrogen is produced in your ovaries, and now your ovaries are basically on retirement. I'm done, I'm out. Well, if you have a breast cancer that is estrogen sensitive, it's going to grow significantly slower because you just don't have those estrogen levels. If I replace estrogen in a postmenopausal female who does have a breast cancer that is sensitive to estrogen, that tumor may grow quicker, but that hormone replacement and then estrogen is never going to cause the breast cancer. I actually remember I had a patient who developed breast cancer while she was on therapy, and she actually thanked me. And she was like, had it not been for me on estrogen, I may have been 80 years old before this was determined, and not in a health situation where I could have fought it as well as I did young and healthy. And I was like, that's a really profound way to think about this. But we know that estrogen, especially estradiol and estriol, which there are multiple types of estrogen, actually has some breast protective benefits to it. So where there's that concern of breast cancer and uterine cancer, actually there's a lot of protection that can happen instead of those negative causatives.
That is huge.
It is.
This is something, I mean, good grief. To be able to have somebody come to you and say thank you, man, that almost renders me speechless here.
Me too. I mean, I wanted to hug her and thank her for her perspective on it. And it really challenged my perspective too. It's like, well, yeah, if I had to have an illness such as a cancer or breast cancer, I would absolutely want it younger rather than older when it has the chance to really challenge my life versus when I'm young and healthy and can fight it.
And luckily, I think cancer treatments are becoming more specific and targeted, and they
Mhm.
don't ravage a person quite as much as what they used to in the past. So that's a good thing.
And I think we're on a really great pathway in that functional medicine whole part of medicine of really finding ways to potentially decrease risk of cancer. I mean, not just worrying about it when we have it, but what can we do to help prevent it while we are alive and young and healthy?
This is something that I was just speaking about with another guest that I'd interviewed, Barton Scott, who is an expert on minerals
Uh-huh.
and how minerals and diet are so important in helping the body create the appropriate hormones. And
Huh?
so again, it's like, okay, well, if we really want to be healthy, we got to start looking within and treating the inside, so then we get the beautiful outside.
Yep, we do.
And this is something I think that plays in as well when you're talking about PRP and stem cell work as
Mhm.
well.
Yep.
And that's something I'm a little bit familiar with in regard to the microneedling training and the
Uh-huh.
microneedling that I do for people's faces.
Yep.
However, I don't do the PRP work. For our listeners, PRP is platelet-rich plasma. And if you want to talk a little bit more about that, Melissa, you're probably a little bit better equipped to do that than I am.
So it's a procedure that's been around for more than 50 years, got its start in basically wound care and healing. Ortho kind of was the next to take line. And then it really took off in the aesthetics and sexual health and wellness venue. It's a super easy process in which we draw blood, spin it down, and concentrate out platelets. Platelets are responsible for growth and healing. They basically activate that wound and healing cascade. So wherever they're injected, it repairs. So, but if we're in the microneedling procedures like you're talking about, builds collagen. So we get a more youthful anti-aging approach to it as well. But one of the avenues that is really under talked about is that sexual health and wellness piece, whether for men or for women, but specifically for women, to be able to improve orgasm, sensation, without having to go through a bladder sling, to improve urinary incontinence and just overall better physical relationships and intimacy with your significant other or partner as well. I mean, just we talk about it a lot from the aesthetics and the microneedling, but I think that that whole sexual health and wellness piece of it is underutilized and under discussed.
Well, this is definitely something I've not heard of before. So now you've got me curious. Is this a procedure where the stem cells or the not stem cells, the plasmas injected into those areas, or how does that work?
Yep, correct. So trademark name behind that would came from a Dr. Charles Runnels, and that would be the trademarked O shot or Priapus shot. But specifically in females, yes. So injected, you're going to take that PRP and you inject it into the vaginal wall and then directly into the clitoris as well. I know most gals are like, yep, nope, wouldn't do it. Sounds painful. I can tell you minimally painful at all. There are actually no nerve endings in the vaginal wall. So the vaginal wall portion is relatively painless. And then the clitoral injection is always done with a block and numbing as well. So it really minimal on the pain scale, but the benefits are absolutely fantastic. I'm always transparent with my patients on where I've been. And these are procedures that I've done in myself. And I will tell you, with my first PRP, I've got two beautiful babies that were born vaginally. So urinary incontinence was definitely something I struggled with. Yeah, don't ask me to laugh, cough, sneeze, or heaven forbid, get on a trampoline with the kids. It just wasn't going to happen. But it was also affecting my ability to run. I'm an avid runner, really enjoy it. And I gave up running outside because of kind of that negative effects from having kids. And within 8 weeks of my first PRP shot, I was probably 80 to 90% improvement in my urinary incontinence. I mean, I could go run outside, I could hop on the treadmill. It didn't matter. I could get on the trampoline with my kids. There was no crossing of the legs when you had to sneeze. And I ended up repeating a second time. And for one of the first times in my life, orgasm got really easy. So not only did I have kind of that medical urinary incontinence improvement, but my relationship with my husband improved dramatically just because sex wasn't frustrating. It was enjoyable and something that both of us were benefiting from, which only increased our intimacy in our relationship as well.
That's huge.
Fantastic. And in a simple in-office procedure that really takes 15, 20 minutes.
Wow. And was this done in combination with pelvic floor therapy at all, or was this just on its own?
This was just on its own. So it was actually years later. I ended up having a partial hysterectomy and they recommended pelvic floor therapy, but geez, it was 5 years before I got to that point, before I needed any pelvic floor. And even now, my benefits have maintained. I will repeat about every other year, every 18 months, just because I don't want to go back to where I was. And I know that I don't age in a bubble. So I know that there'll be regression, but I prioritize my health and things have been fantastic.
That's amazing.
So no pelvic floor, none of the RF vaginal rejuvenation procedures, strictly just PRP.
Wow. That's really cool, because this is something that I know a lot of women experience, and yet it's kept very quiet.
And that's kind of my stance and why I'm always so open with my patients on what have I tried? Here was my experience, because I was 33 at the time when I first was experiencing really some traumatic symptoms that I found myself altering my exercise, not being able to play with my kids the way I wanted to. And I was frustrated because for me as a provider, as a practitioner, I didn't even know where to turn. What are my options? Where do I go? What do I do? So I've really kind of taken on myself for it to be my mission for patients to know that I'm a real patient, even though I'm a physician, and that I've been in your shoes. I've experienced what you've experienced. And education is so important to me, not only of my colleagues so that they can have the appropriate conversations with their patients, but for patients to know, hey, there are options out there. You don't have to sit and suffer.
Is this something that you used in combination with hormone replacement therapy, or are they kind of separate?
So for myself, again, 33 was really when I started to notice that shift, when traditional medicine will kind of tell you, well, you're decades away from menopause. I was really noticing poor sleep, irritability, energy changes, libido changes. So at 33, had my hormone levels checked. My testosterone level came back at 7. Optimal for a female is 100 to 200. And I'm like, okay. I didn't have any progesterone, but I wasn't at a place where I was really ready to go into replacement. So the PRP portion I did alone by itself. And it's really just been in the last couple of years. I'm 41 now, again, really transparent. Just in the last couple of years before I started hormone replacement, after I had my partial hysterectomy, really noticed an increase in some of my symptoms where I was managing the low testosterone fine. Now I wasn't as much. And that's when I went on the decision to start with testosterone replacement. Now progesterone, which irritability, sleep, anxiety, headaches, mood, I was checking a fair number of those boxes. It's an easy hormone to replace. So I started on progesterone basically by 35. I was that mom yelling at my kids. I still remember sitting in the kitchen and yelling at my son to, oh my God, put your socks on. Why haven't you put your socks on yet? I've asked you 3 times. We need to leave in 10 minutes. He's crying. I'm crying. And I'm like, this isn't the mom I want to be. What is wrong with me? And that was really my trigger point where I'm like, okay, you need to do something about it. So started with the progesterone at that point. And then again, just like I said, in the last couple of years, added in the testosterone, which is fantastic.
This is something that I find so fascinating in that there are these like crossing of paths between
Mhm,
modern medicine and traditional Chinese medicine.
mhm.
Because I have these moms that are kind of in the same situation, and between acupuncture,
Mhm.
Chinese herbal medicine, a
Yep,
little bit of massage, some
yep.
dietary changes, all of a sudden they start seeing improvement
Mhm.
in some of these well, these symptoms. I think that's the
Yep.
best way to put it. They see
Best.
improvement in the symptoms. I'd be curious to see if there are studies out there that show that acupuncture, Chinese herbal medicine help
Mhm.
balance these hormones as well. But this is definitely something where I think every medicine has its strengths and its weaknesses. And so what we're seeing here is this is something that functional medicine really excels at, and it's a beautiful thing.
Mhm. I think we'd be remiss to say that kind of some of the non-traditional Western medicine, the acupuncture, the herbals, if we didn't agree and believe there was a place for them and that they didn't make improvements. I mean, no different than diet. Diet can have an impact on hormonal balance as well. So I think it's truly about optimizing and picking the, I'll say, plan that's right for each individual.
And how do you go about finding that plan for those individuals?
Well, one of my favorite questions to when I sit down with a patient is to ask them, what are your goals? What do you want to see better? It's not about me and what I can tell them what I think they need, because if their only goal is to improve their libido, then we have a completely different conversation than, if it's I need to get rid of my hot flashes, my night sweats, my irritability, my focus is terrible. I have no energy to do anything. I don't feel like me anymore and I need to find that is completely different. And some people will come to you and just say, I feel good, but I really want to optimize my aging process. What does that look like? And that's the beauty of functional medicine is we have all these different kind of boxes that we can pull off the shelf to craft it specifically for each patient.
And I get the feeling that once you start working on one of those issues, you tend to see changes in other aspects of that person's life as well.
Absolutely. Absolutely. I mean, eh, if, for example, and we kind of keep coming back to the libido, but let's say there's marital strain because you're on different pages on libido and your desire for each other's standpoint. Well, if you correct that, now your relationship is better. So you're communicating better, which typically means outside of the home, your relationships are better. And honestly, as we start to balance things, you'll find that you're much more equipped to handle the daily stressors. I mean, that is part of hormone deficiency is you become ill adept at handling those daily stressors.
And that makes it pretty doggone tough.
It is. And I think one of the biggest struggles for most of us out there is we hear so much about menopause. It's truly this perimenopausal female in her 30s to 50s who feels like there aren't any answers for me. I'm not in menopause, but could I be? We are not doing a great job as a medical community in educating these women. Hey, this is not normal. I get you feel like you're having an out of body experience, but that's not normal and not how you're supposed to feel. I was having a conversation with a patient a couple of weeks ago, and we were laughing, and I was running through some of her symptoms, and I asked her if she was having brain fog or focus concentration problems. She's like, no. And she goes, well, wait, what do you mean? I'm like, do you go into the laundry room and wonder why in the heck am I in here? I'm supposed to be doing laundry, but I don't know why I came in here. And she was like, oh yeah, every day I go downstairs to grab a LaCroix. I get down there, I forget why I'm there, and I go back upstairs. And then I'm like, oh yeah, LaCroix. Go back downstairs for the LaCroix. And she goes, wait, that's not normal. And I'm like, no. She goes, but all my other moms complain about the same thing. I'm like, it's not normal. But we lean on each other for what is normal. without the education that, hey, you don't have to feel this way, and things like this technically aren't normal and can be improved.
I hear you 100% there. I have patients, female patients, who come and they say, well, yeah, I get all these premenstrual syndrome symptoms.
Yep.
I get the cramping. I get the breast distension. That's normal. No,
No.
no, it's not. We've normalized it in our society, but that doesn't necessarily mean that it's actually normal for us as human beings.
Correct. And we talk amongst the same groups who are having the same symptoms. So we still, it confirms our associations that it's normal.
Good.
As you can see why I'm so passionate about the education. How do we tell people, how do we teach women that there are options and that you don't have to feel this way? And men too.
On how do folks get more information from you? Do they have to come see you in Nebraska, or do you have services that you offer online? How do people work with you, Melissa?
So I am licensed in 5, almost 6 different states, most in the Midwest, Nebraska, Iowa, Kansas, Missouri, South Dakota. Texas is pending, Missouri and Colorado is pending as well, with an Oklahoma in process to ages, so that we can reach that broader perspective of people. A lot of people will do telehealth if they're not in Omaha. Honestly, for us, a lot of it's just word of mouth. I definitely try, and I have done some Instagram lives for education purposes only, just because I want people to know, because I've heard it for so many years. Well, why didn't my primary care tell me about this? Honestly, our education doesn't include this. We've got to spend the time educating ourselves. So I always tell people, follow us on Instagram, because there's lots of great free information that we will put out there. The website, which also will have some great information. Just for me, the whole purpose is education. Whether you put your care and your trust in me, hopefully you learned something and you took away maybe a little bit different perspective, so that you can maybe continue your quest for education and know that there are options out there to help you.
And what's your Instagram handle?
So we are RE-NEW and then _ Institute.
All right. I will include a link to your website
Awesome.
and your Instagram on the show notes.
Thank you.
Listeners, you can go to thegetfoxyshow.com and check out this episode, and all that information will be there in the show notes. We're going to switch it up, and I'm going to ask you the question I ask all my guests, and that is, what does Foxy and being Foxy mean to you, Dr. Melissa?
So to me, it's confidence. The confidence in yourself, and who you are, and who you want to be in your life. But also it's the confidence in making sure that you've found you. And I think that for most of us, as we continue to age, we go through this process where we almost feel like we have an out-of-body experience. So in confidence in knowing that you're still there, and that best version of you is absolutely there. It's uncovering it, and just being comfortable with who you are.
Now, if Foxy to you is feeling confident and being comfortable in who you are, we're not always in that state. So when you're not in that state of feeling Foxy, what do you do to reclaim it?
So always one of my first questions is why? Why do you feel like you've lost it, Melissa? Was it a diet derailment? Did you not sleep well last night? It's getting to the bottom of why do I feel like I'm off? Where is it coming from? Pinpointing it. And maybe it's getting up and putting on a nice dress and doing your hair and putting some makeup on to make you feel more Foxy. Or maybe it's flirting with your husband or significant other. I mean, for me, it's really figuring out, why did I lose it? Why don't I feel that way? And how can I put myself in the mindset to be Foxy and confident and comfortable with me?
And are there specific things that you do to get yourself in that mindset? Are you journaling? Are you meditating? Do you exercise?
I am terrible about journaling. Exercise is really my big one. I know I had a conversation with my husband. He's like, you should probably really do some more strength training. And I'm like, yep, nope. The treadmill is just my mental purge. It is my meditation. And making time for the things that are important to me are really how I keep that balance. I understand, and I've spent a lot of time working hard, but I want to make sure that my kids have time, my husband has time, prioritize my relationship with the people who matter to me, and know that that all starts with me. So if I'm not taking care of me, they're not going to get the best version of me.
Amen to that. It really boils down to taking care of you so that you can then take care of those around you.
And what do you need to do that?
Yeah. Figuring that out so that you can then fill your cup so that then you can fill others.
Yep.
Because otherwise, if you're burning out, well, then you're not helping anybody.
Yep. You have to prioritize you.
Well, Melissa, this has been an absolutely fascinating conversation. I so appreciate you taking the time to chat with us today. And one more time, what's your website so that people can find you?
So our website is www.re-newinstitute.com. So Renew Institute is us. And you can always search me at Google search Melissa Loseke, and hopefully you'll pop up there too. But Renew Institute is us, RE-NEW, both on Instagram and on Facebook, as well as our website.
Beautiful. And we'll have links to that. Melissa, thank you for being out there, serving women, serving men, and helping improve their lives. You are doing great things in this world, and I honor you for that.
Thank you for having me. Today was a pure joy and pleasure. I appreciate it.